The country's population has reached 112.7 million based on a 2024 census released by the Philippine Statistics Authority. The latest count includes residents from all 18 regions and Filipinos stationed abroad as of July 1 last year. The population rose by 3.69 million from 2020, but annual growth slowed to 0.80%, down from 1.63% in the previous 5-year period. PSA cited declining birth rates, pandemic-related deaths, and lower migration as key reasons for the slowdown. To help us understand the numbers and what they mean for the country's future, we have Joseph Cajita, OIC Assistant National Statistician of the PSA, and he joins us now via Zoom. Magandang umaga po sa inyo.
Yes, good morning, ma'am. Thanks for this invite.
The population of the Philippines is now officially at 112 million in the latest 2024 census. What are the latest findings on that, the key takeaways?
Yes, ma'am. We have just released the official results of the 2024 Census of Population, and this was declared official for all purposes by the President by virtue of Proclamation number 973. So right now, we're releasing the headline population figures, and as indicated earlier, it's 112.729 million, and that translates to 0.80 population growth rate from 2020. And then looking at the figures for the regional distribution, we had Region 4A, and then NCR, and then Region 3, recording the largest population in 2024. And as usual, the least populated region is the Cordillera Administrative Region with 1.8 million.
Mm-hmm. And then ito nga po yung striking dito, no? Well, while the population has grown, the growth rate has slowed down. That is from, nabanggit po ninyo, yung 0.8%. From 1.63% from 2015 to 2020, naging 0.8% between 2020 to 2024. Ano po yung nag-cause po nung slowdown po na yun?
That basically mirrors the classic demographic transition. So nabanggit naman po natin kanina from high fertility mortality to lower fertility mortality driven by a lot of factors, urbanization, health improvements, and coming also from the 2020 pandemic. And then subdued migration as well. And then considering na mababa na yung fertility natin, so as recorded in the National Demographic Health Survey, nasa 1.9. So nasa past replacement na po tayo, specifically in highly urbanized cities.
According to putting this into context, no, I mean, these numbers will only mean something if it relates to the growth of a population. Ano po yung healthy levels? Are we still within that? And ano po ang impression dito ng PSA? Is this slowdown something that is welcome or something that we need to work on to improve it further? I mean, 112 million population of the Philippines. Marami-rami po tayo kumpara sa ibang bansa. Ano po yung pagtanggap dito, appreciation ng PSA?
With the 0.80 na annual population growth rate, ang ibig sabihin lang nito, stabilize na yung ating population, and then over the years naman, pababa na naman talaga yung population natin coming from 1.60. So basically, it's a good indicator also na na-control yung population.
Okay.
And as we look forward, siguro in the next census rounds, bababa pa ito, and as expected.
Ano po ang ibig sabihin nung effects of migration? I mean, subdued migration activity is a cause of that slower growth rate. What do you mean by that?
Coming from 2020 kasi, di ba, maraming mga bumabalik and then nakabawi lang after post-pandemic. So, basically, we are saying, kung i-relate natin sa fertility, most of those na lumabas naman, mga women of reproductive age. So, nasubdued yung mga pregnancies, and then ma-relate na rin natin sa lower fertility level. So, bumaba yung mga birth rates natin.
Because usually yung nagmamigrate yan yung mga
Mga women natin of
Oo.
reproductive age.
adult age na or young
Yeah.
professionals. Okay. Of course, this is affected by the pandemic, the fertility and birth rate. But yun, mga nabanggit mo naman na regions ho, ano po nakikita natin doon sa mga nagre-register ng higher population? So what does the data tell us? Because I believe there is an increase in the BARM region.
Sa BARM naman, naiiba lang ang BARM kasi mataas talaga ang fertility sa BARM. And then, yung population trends naman sa BARM ever since, sila talaga yung fast growing na region. Unlike with the other regions. Now, in highly urbanized cities naman, and basically we're saying about yung sa mga growth areas ng mga regions, specifically in Region 4, NCR, and Central Luzon, after the pandemic, nagbabalikan naman din sila. Kaya ganun pa rin yung trends natin sa population in these areas.
Okay. Paano po ginawa itong census na to? Ano po yung proseso ng PSA in documenting everybody o the whole Philippine population?
So we conducted the nationwide census July to September 2024. So house to house po tayo. And then we use the computer-assisted population interview natin, tinatawag natin copy. We use tablets in interviewing our households. And then we employ more than 160,000 enumerators nationwide just for these big operations.
How many volunteers?
We hired a total workforce of 160,000. So that includes our
160,000.
census enumerators, team supervisors, census area supervisors.
Okay. Actually, parang na-interview nga po ko, naalala ko nga last year,
Yes,
parang meron po ako sinay na tablet. Sabi ko, ano to, bakit nagpunta yung PSA sa bahay ko? Pero, but you know, we do understand that people sometimes go from the city to the province. Paano po yun? Yung mga ganun na tinatanong niyo po sila kung saan talaga yung main residence nila, tapos doon nyo sila sinisenso sa lugar na yun? How do you prevent double counting?
The jury kasi yung concept nating population, so that means yung usual place of residence. So meron po tayong mga parameters kung paano i-qualify na ito yung usual place of residence natin. So usually, kung hindi tayo umuwi sa, kung halimbawa, dito ka sa Maynila, and then on a weekly basis umuwi ka ng Cavite, you are supposed to be counted in Cavite. So yung ganun po na mga definitions at parameters natin on the inclusion and exclusions.
Oho. Paano po yung mga nasa condominium na nakatira? Paano po natin sila pinupuntahan? Hindi naman pwedeng unit to unit po yun. I mean, how do you track the number of people inside?
We have coordination with mga condo administrators, and then also, hindi lang sa condominiums, yung mga exclusive subdivisions. We have some coordination with the officials, mga homeowners associations, and then meron kaming mga naka-schedule by appointments in order to interview yung mga unit owners or yung mga nakatira sa mga condo units na ito.
Does this data capture the late registrations of birth?
Meron kaming data item sa census on ang question namin doon ay kung ang kanyang birth ba ay na-registered or not. But we don't have information whether it was delayed or on-time registration. So the question was, is your birth registered in the local civil register?
So, meron po ba tayong data doon kung gaano karami po yung nakapag-register?
Hindi pa siya nakakalabas ngayon. In coming months, kasama na po siya sa i-release ni PSA along with the other demographic.
Sabagay kasi ano ho yun, face-to-face, kaya technically
Yes, ma'am.
parang pag nakita mo na yung tao, tinanong mo kung ilan na yung anak niya, you get a good sense of iilan nga sa bahay. Pero in terms of the composition of families, I mean, do we have data on that? Like, what's the current trend? Ilan po yung nagiging anak ng bawat pamilya? Dumadami po ba? Kumukunti po ba? And pagdating sa urban center, sa rural, ano po yung pagkakaiba? Do we have data specific down to that level?
Kasama po yan. We're talking about the household membership, the household size, and then we computed the average household size. But right now, hindi pa siya kasama dito sa na-publish natin ng mga reports. But in the coming months, may papalabas na po natin para ma-determine at makikita yung family size or average household size. But mostly, in our observation, medyo bumababa po ang ating household size. So parang with the emerging demographic structure, particularly doon sa mga family structures, dumarami yung mga lumiliit na mga household sizes.
Well, of course, sabi nyo nga, no, it could mean, on one hand, that the population has stabilized and that we have taken better control over the growth of the population. But that, of course, is yet to be seen and put into its proper context. Kung birth control measures ba ito o nadi-discourage na yung mga kabataan na magkaroon ng anak, I mean, given the happenings all over the world. Pero ito pong population po natin, ano po ang age range? Karamihan po ay anong edad?
Makikita natin yan in the coming releases kasi papalabas natin yung age, sex, composition. But right now, nakikita namin, nasa gitna pa naman po tayo. Although, papunta na po tayo, hindi naman po tayo aging population pa.
And I guess that bodes well for the Philippines because in other countries, they have already been seeing this as a problem na tumatanda na yung kanilang populasyon. So malayo naman po tayo doon. We have a robust workforce to work with.
Sa ngayon, yes po. But in the next census years, decennial census tayo. Sa susunod, baka pababa na talaga tayo. And then there will be more grandparents than children going to school.
Well, what's next after the release of this data? How will the PSA census be used or could it be used by other agencies?
For one, yung population counts kasi natin kaya kinakailangan this has to be declared official by the President through a presidential proclamation because this is used by the Department of Budget Management for the NTA allocation sa LGUs. And then for planning purposes also for other government agencies when it comes to housing, social services, and then other economic programs as well.
Ito po ay yung data po na kinuha po ninyo, meron po ba itong social stratification? I mean, yung in terms of income, in terms of capacity, may ganun din po ba kayong nakuhang datos?
Hindi po siya kasama sa census of population. And yung ibang mga datos na yan, makukuha po natin sa ibang surveys na kinakonduct ng PSA. Like for instance, sa Family Income and Expenditure Survey.
Pero doon sa 112 million, gaano karami po doon na nakatira sa urban at gaano karami sa rural?
May papalabas po natin ang datos na yan in the coming months. Kasama po yan doon sa other demographic characteristics and other social characteristics.
Okay, mukhang i-invite po namin kayo ulit kasi marami kami gustong malaman. Ayun nga lang, ito pa lang yung pwedeng pag-usapan at ma-release ng PSA. But for now, no,
yung population data lang po tayo ngayon. And then down to the
how often is this census conducted? Is it yearly?
Every 10 years yung ating decennial census and then meron din tayong Medicaid census. And this one is a Medicaid census. So basically we're saying every 5 years.
Every 5 and 10?
Yes po.
Lalabas po. Oo. All right. Okay. We hope this guides policy decision making and helps us plan better for the future of our country. Maraming salamat po, Joseph Cajita. We have OIC, Assistant National Statistician of the PSA National Census Service, joining us this morning.
Thank you so much. Good morning.